how are you feeling this morning? How's your community?
Well, I think our community is still a little bit confused, and I think what was just discussed just now, the fact that there needs to be clarity in the rules, that hasn't happened. We had one announcement at 11 a.m. and a different list at 11 p.m, and I accept that tweaking always needs to happen, but we need to try and get it as clear as possible from the beginning, because we've been overwhelmed with inquiries from people. People don't want to do the wrong thing. People want to do the right thing. But unfortunately, people just aren't clear whether they can go to work or if they can't go to work. So I think there needs to be a list published of different workplace industries, clearly outlining if people can go to work or not, especially in South West Sydney, where it's a multicultural community. People just don't know.
Yeah.
People are getting tested. Our testing clinics are getting overwhelmed, which is a good thing, but also at the same time, test results are taking 3 to 4 days to come through, and that's a challenge as well. We should be getting those test results as soon as possible. So I think we need more resources in providing those test results, and we need greater clarity for the residents to make sure that they can or can't go to work. It's tough enough right now for people that can't see their families and can't go and have their job, not knowing whether they can go out or not.
So yeah, you mentioned the multicultural communities and for those households where English might not be a primary language. How is the messaging getting through at all?
Well, it's not. That's why people are coming to councils, they're coming to elected representatives, and they're phoning New South Wales Health up. But it's just word of mouth. I think social media is playing a big part. But of course, in social media, you get 10 right answers and you also get a few wrong answers. So it's really tough. It's just really tough. And I think that list needs to be published. I know they've given an authorised workers list, but it needs to go along different industries. And so we can all get that out in a simple language, not in a language that can't be read by most people in the community. It just needs to be really simple, really clear, so people just can get on with doing what we need to do. We all want to get out of here. We're sick and tired of the virus. The virus is tearing us apart when we should really all be coming together united fighting it.
And when you see images of people outside of your LGAs, people at the beach in the north or in the east, gathering about and going out for walks as they are allowed to do, but there's not many masks out there, and we're seeing the New South Wales Premier, she's on the front page of the Daily Telegraph this morning without a mask after she got a coffee, which is allowed. But is there a mixed message there that kind of isn't really translating, that might be hard to cop?
Well, there's no doubt residents from Fairfield and South West Sydney see all that happening and they get quite upset. We need to remember that this whole virus started with one person that leaked it out from an airline stewardess or crew, from the limo driver. It all started with one person. And currently the virus isn't just in South West Sydney, it's across Greater Sydney. And all I can say is we don't want to see what's happened out here happen again in Bondi or Northern Beaches or in a city. People should just be careful, just be aware of it. And, at a time where we're all trying to do the right thing here in South West Sydney, we just want the whole of Greater Sydney to unite. Let's all do this together, because ultimately we've seen what happened. The virus travels. It's travelled between nations, states and suburbs, and unless we all do the right thing, we're just going to be back to square one again.
Are you concerned at all, or are you seeing any evidence of frustrations boiling over, Frank?
Yeah, I am seeing a lot of good people, good families, just really confused, really frustrated. They just don't know what to do. They're at their wits' ends. They have businesses outside the local government area. Some work outside the local government area and some inside our own government area. And they just don't know what to do. They want to do the right thing. These are law-abiding citizens that just are caught up in the whole confusion. We need the government to come out today and clearly define who can and can't go to work. People will obey. We all know that this virus, none of us want this virus to spread. We don't want our loved ones to die. We want us to get through this so we can get back to as much as normality as possible. And all I'm asking is from the leadership, from New South Wales government, just to be clear on the definitions and put it in a language that's easily understood by everybody.
What do you think should be an essential worker?
Well, it's a difficult one. I don't have the health advice. We don't know what the health advice is. The Premier knows what that is. She gets to see the numbers before she announces it.
I mean, everybody would like to believe that their work is essential. That's the problem.
Well, essential worker should really be the work that needs to keep the community going, society going, even through a lockdown. That's what it should be. And I think where the backflip occurred, I don't think they realised that amongst 1 million people here in southwest Sydney that the government locked down and said you can't go out to work. Even though these people were the safest workers in the country because they were all getting tested to leave. That's the funny thing. People could come in and not get tested to come into our LGAs, but our residents need to get tested to go out. So that provided at least some form of confidence that they didn't have the virus. But the big issue is that it needs to be clarity around the different definitions.
Okay. Frank, appreciate your time as always. We'll talk to you soon.
Thank you, Pete.